Can you describe any leadership activities or leadership positions that you've held in the past?
Leadership activities. I haven't. So that's the thing. Like, I feel like,
Have you ever
leadership.
trained anybody?
Oh, actually I have. Yeah.
Yeah, that's perfect.
Okay. Yeah. When I was a medical assistant, as I was getting ready to leave for nursing school, I had to train the newest employee. And I just really emphasized on them asking me questions because I really feel like when someone asks me questions about what I'm teaching them, they're understanding and they're making connections in their head. So I really feel like that's important when being a leader. It's just making sure everyone understands what's going on and what I'm trying to communicate to them.
You maybe add like another piece about how like understanding what questions they have guides you and how best to support them.
Okay, I like that. Yeah.
Yeah.
And then based on their questions, I'm able to kind of move towards whatever, like,
Like
I don't
assess
know.
what their needs are.
Yeah, exactly. Okay. Try
Yeah.
to word it differently, and then I just make it way more difficult for myself because I'm like, you just put it perfectly.
And you have the recording too, so if
Yes.
like you want to go back through it, you can totally do that.
Yeah.
What if they ask you like sometimes they'll say it in a way that's kind of weird, like, what support do you think you'll need from your preceptors? Or like what are you gonna need the most help with as you get started? Or like what kind of preceptor are you hoping for?
Only thing I can come up to mind is someone who's willing to answer all the questions I'm going to have.
Oh, that's fine.
Yeah.
Yeah.
So, yeah, someone who's patient just because I know I'm going to have a lot of questions. I really like to know the why to things. So hopefully my preceptor is willing to tell me why we're doing this and that. So,
Yeah.
yeah.
That's so true. Like in nursing school, they'd be like, don't ever do this. And I'd be like,
Why? Yeah.
what would happen if I did?
No,
You'd kill
exactly.
someone. I'm gonna remember that.
I'm, yeah, I'm the same exact way. I'm like, what? And I remember, yeah, it's funny because like in class, I could tell whenever I keep asking questions, people are like, oh my God, okay.
But
Like,
like if
what?
you don't ask questions and you don't like form connections and understand. So yeah,
Exactly.
like yeah, I'd love to have a preceptor that is willing to answer my questions because I know I'll have a lot of them. And you could talk about how you'd love someone who can show you what your like where your resources are. So like where to find your policies and procedures so that you can really go through them so that you can know for yourself that you're doing it in like the evidence-based practice way that
Okay.
will keep your patients the safest. And then also in terms of like showing you where your resources are, like teaching you how to reach out to the doctors, how to reach out to Rapid, like how to call a code stroke. That way, when you know, like even if there's something that you don't know, you at least know where to find the answer when you don't have a preceptor anymore. Like it'll help you like kind of be more empowered to keep your patients safe in that way.
Absolutely. Okay. I like that.
So that's all the questions that we have for you. What questions do you have for us before we wrap up?
I have a list of questions that I would want to ask.
So
I
I
don't
have
know, like,
a list. Okay, it's cute. Okay.
I mean, I'm a very type A type of person, and like I have all these like things in my head, like
Good.
ready to go. But I mean, I feel like is that weird to just like pull out my little notebook and be like,
No, it's
I
cute.
wrote down.
It shows that
Okay.
like you because those people who are like, I don't care what kind of unit I get, as long as I get whatever hospital, like as long as I get a job. Like, no, like you want someone who like actually wants to work at your place. And like,
Well, that's what I feel like at because my first interview, I was like, oh, I really want this job. But then once I left, I'm like, okay, like this interview, yes, they're interviewing me, but like also I'm kind of interviewing them as well because I want to see
yeah.
if I want to work there. And I feel like after I kind of like shifted that mindset, there's a lot less pressure. So
Hmm.
like now I'm really eager to do these other interviews because I'm like, okay, well, this is going to be a conversation. And I'm very confident in like my beliefs and my, but also like open-minded. And I feel like I I think I'm okay at getting that across. Maybe not in the beginning of this, but like like I once I feel comfortable, I feel like I'm really able to just like get that across.
Yeah.
But
And a
okay,
couple of
okay.
genuine laughs, like if someone who's nervous, like it's kind of endearing. Like don't do it on
Yeah.
purpose, but like if it happens, it's definitely not the end of the world.
Yeah.
It
Okay.
just
Because
kind of like humanizes you, you know?
yeah, I'm like, I laugh. I'm like, I'm sometimes, okay. I feel like sometimes I'm a little too much, but it's okay. I
But I
keep
feel like
things
when it
fun.
comes down to it, like you would not be like that if something was happening with the patient. You'd be like, it's go
Yeah.
time. Here's what we need to do.
Absolutely not. No, someone's turning blue and I'm laughing. No,
No, no.
absolutely
Like
not.
it's clear that
But
you're not that person.
yeah. Okay,
Yeah.
well that's good.
Yeah.
Um, so I guess I some of the questions I wrote down for like the actual nurse managers, like I wrote, why did you choose this hospital and what's your favorite thing about working here? Um, is that
That feels a little
like I'm interviewing them now?
like stepping into their bubble.
Okay.
I would stick to what do you love about working here?
Okay, just what do you love about working here?
Yeah, what's
Okay.
your favorite part about working here? Or yeah, just something where like they could just throw out anything if they don't feel comfortable, just something.
Totally. Okay.
Yeah.
And then also I was thinking about asking them like what opportunities they offer to grow within the company. Is that an appropriate
Maybe
question?
like what educational opportunities are there for nurses on the unit?
Okay. And then your expectations for a new grad, like qualities you would like to see. Is that weird?
You could say something like what qualities do you think are like make new grads successful? Or how do you say that? Like what are the qualities that you think are really important for new grads to have in order to be successful?
Could I maybe even just totally change that and just like, what's your advice for a new
Yeah.
grad starting?
Yeah.
Something like that?
What a lot of
Okay.
people ask that I really like is if I were to get the job, what would be the best way for me to prepare in the meantime?
Okay.
That's a really good one. Um, Another question is, what's the patient population on the unit? Because they'll be able to tell
Okay.
you, like, is it all trach patients? Is it all like GI surgeries? Like, what kind of patients are you working with? Is it like a little bit of everything?
Okay.
And then you can ask them, can you please just share a little bit about the new grad training process? And then they'll tell you
Yeah,
like,
that was one of the questions I had. Was
yeah,
kind of like, what will orientation and training look like?
yeah, yeah, that's a really good one because it tells you like, are you gonna get 3 weeks with a preceptor? Are you gonna get 3 months? Like, are you gonna have one preceptor, like five? Are you gonna have like weekly meetings with your manager? Like, are there classes? Like that kind of thing.
Okay.
Um, and then they might ask you, if you prefer days or nights. Do you know what you'll say if they ask you that?
Um, days, but I when we're talking nights, are we talking like night shift or like
Yeah.
evenings? Okay, probably. I mean, I days. I physically like I've tried doing all-nighters and I cannot. Like my body shuts down.
If they offered it to you as nights, would you take it? Or probably not.
I would.
You would.
I would.
So what I would
I would
say
definitely
is,
try.
I'd be, I would love to work here. I would be very happy for either, but I do have a preference for days. I think I'd be suited better to the schedule, and I think I'd have a lot more learning opportunities in terms of working with different members of the interdisciplinary team. Because you get
Okay.
to work with like physical therapy and occupational therapy and the
Yeah,
doctors and
exactly.
like be there for rounds and all this other stuff.
Okay.
But keep in mind it is possible that it's like only night shift, and like if you say that, they might be like, oh, if we hire her, she will not be happy because all we have is nights. So
Yeah,
let's give it to the guy
that's
who's super excited about nights.
Yeah, that's very true. So I guess I could word it like you did. Like I would like days better because I feel like there's more opportunity to like see, interdisciplinary team and all of that.
Yeah.
I wouldn't word it like this, obviously, but just
Yeah. Like
yeah.
make it sound like you have a preference, but it's not like a deal breaker.
Okay.
And you'd still be very happy.
Okay. And then so I was wondering like with when can I ask about like how their scheduling looks? Like when you get the schedule, like is it a week? Is it a month ahead?
I wouldn't
It's
ask that.
okay.
I would wait until you have an offer and then ask that.
Okay.
Yeah.
Okay.
Yeah.
And then what, medical record system do they use? I feel like I just personally want to know. Is that an okay question to ask?
You could, it strikes me as a little like now we're getting into like I don't know,
Okay.
other
Like, oh,
stuff.
I got
Like
hired already.
it's just kind of like if we used a system she didn't like, would she not want to work with? Like, I don't why is she asking this?
That's
You know?
true. That's
Probably
very
because
true.
you want to
Okay.
hear that it's the one that you're familiar with, and you would be like, Yay,
Yeah.
like I already work with Epic or whatever it is.
Yeah. Okay. That's true.
And then the one that really helps with thank you letters is
Uh-huh.
people will ask um what are the goals that you're currently working towards on the unit?
Mhm.
And they might look at you like, what do you mean? And you can say, or you could even ask it more specifically, like, are there any goals that you're working towards on the unit right now that you're excited about in terms of like improving outcomes, reducing infection, that kind of thing? Because
Okay.
chances are they're either working on like reducing falls or reducing infections or um, that kind of thing. In your
Okay.
interview or in your thank you letter afterwards, like instead of structuring it where like I feel like the typical one is like, thank you so much for meeting with me. Here are all the reasons why I'm such a strong candidate. Thanks again, name, and it's just like, blech,
Yeah.
I already heard all of this. If you can do it more of like, thanks for the opportunity to meet with you. I really loved hearing about this thing that you shared. And it was really great that you said you value this because I think that's so important. And also, this unit improvement project that you told me you're working on, I'd love to learn more from you about how to achieve those goals together. Thank
Okay.
you so much. Looking forward to hearing from you. Kind of structure is so much more engaging, and it sounds like you actually connected with them than just like, here's all the reasons why I'm awesome.
Yeah.
Yeah.
Definitely. Okay. I will
Yeah.
definitely keep.
So it kind of gives you something to work with based on what they tell you.
Yeah, it's more personable. It's not like, oh, I can send this thank you to every single person that I just interviewed with and it would apply to them.
Yeah.